I think gradually we've become to understand that erosive tooth wear is the third most common dental condition. And as a profession, we can no longer afford not to measure it and to assess it at every patient. So now is the time, I think, before we start getting many medical legal problems and other situations, to actually get dentists to regularly monitor erosive tooth wear at every clinical dental exam.
So 1 in 3 people have erosive tooth wear, and the main cause of that is through the diet, and that's an increase in the frequency of acidic foods and drinks. So what we're finding is that people are snacking more and drinking more acidic drinks. They're not just content with water anymore. They're putting a little bit of flavouring in that water, a bit of cordial, or else a squeeze of lemon, or else those fruit infusers that they have, and they're sipping on those throughout the day. Or they're snacking a lot more on fruit, and all these fruits are available outside of season. So it's the combination of snacking and drinking on different acidic foods all throughout the day that has led to this increase in erosive tooth wear.
Erosive tooth wear is really important because it is now affecting 1 in 3 people in the country. And erosive tooth wear, it is not a matter of getting a cavity in one tooth or damaging just a cusp or an incisal edge. Tooth wear affects virtually all of the teeth. So once you get erosive tooth wear, you have a problem with most, if not all, of your teeth. And therefore putting it right is not just fixing one tooth, it's got to fix all of the teeth. So all the more reason to say, let's prevent it and stop it in the first place.
The clinical record card does need to contain information about the extent of erosive tooth care, and an index is a good way of recording that. And I think it's not only is it good practice, but I think it's also a good example of proactive risk management, because you don't want to be in a situation where a patient who's been seeing the same dentist, say, for a decade or more, and then has a change of clinician, new dentist says to the patient, did you realise that this has been happening? Have you been given some advice? And the patient feels that they haven't been, and then they go back to the original dentist for the clinical records and find that there's actually no documented history. And it's the lack of documentation that often compromises the defence in a case. So we think as an example of sort of proactive risk management, using indices generally for oral health is a good thing, and tooth wear would be part of it.
The first thing that that dentists can do is by looking at a patient's diet and medical history and identifying any risk factors that are there and present. Then they should go and examine the patient's mouth and look for acid wear on the teeth. So we recommend using the simple tool called BEWE, the Basic Erosive Wear Examination, which looks at all the surfaces of the mouth and grades the worst surface in each sextant, and you record that for the whole mouth.
So the dentist looks at the mouth at the same time as they do the BPE, which is something they're used to doing. They look at each sextant and grade the level of tooth wear, 0, 1, 2 or 3, 3 being greater than 50%, 2 being less than 50%, 1 being early damage and 0 no wear.
Tooth wear is something that dental hygienists and dental therapists, they're aware of, but they don't necessarily record it or identify it, or they may on a routine basis. And I think that's been a lot of the discussion today, that there's not always a consistent recording or discussion about tooth wear. And it's something that hygienists and therapists need to kind of be more familiar with.
Many attempts at implementing sort of effective risk management strategies tend to be centred in a reactive way, because events and incidents arise, and these events and incidents lead people, quite understandably, to think about what could have been done to avoid them. And that sort of reactive approach to risk management has served us very well for a long time. But I think there is another way to do it as well, and that is to anticipate the events and incidents that might arise. And I think that's all about spotting trends and patterns before they're established. So I think something like erosive tooth wear, recording it, having a conversation with the patient is an example of what I would call proactive risk management. It might not be a significant medical legal issue now, but it certainly has the potential to be one in the future.
Erosive tooth wear is something that it is not just something that's occasionally seen now. It is so common, it has to be part of your everyday thinking of managing your patients. everybody wants to do their best for their patients, and to continue to do that, it's now important that erosive tooth wear is in the front of your mind, together with caries and periodontal disease and the other needs of your patients, in fulfilling your expectation and their expectation of good care and good clinical outcomes.